Congratulations on making it to this point in your career. Let's take a few minutes to look at what you can expect as you prepare for your practical exam. It took a lot of work and preparation to get where you are. You made it through school, through residency, and now you're ready to become ABC certified. So, what can you expect at the Prosthetic Clinical Patient Management Exam? First, remember, you will not be doing this alone. Most likely, you'll be taking your exam along with 19 other prosthetic candidates, and they'll probably be just as nervous as you are. It all starts with orientation. This is where you'll sign in, show your ID, and get acclimated to the day. Once everyone is signed in, you'll watch a video explaining the flow of the exam and what you need to successfully navigate the process. This is also where the first phase of the exam begins. You'll be asked to perform a gait deviation task and identify the specific gait deviation and the most likely cause. Once the orientation process and the initial tasks are finished, you'll move on to the hands-on exam stations. At this point, you'll head to the candidate lounge, your home base between each section of the exam. Don't worry about finding your way around the testing site. You'll have a candidate liaison who will be with you for the entire exam. Your candidate liaison's job is to help you stay calm and focused throughout the exam. And he'll also explain how the exam stations work. Your liaison is a seasoned examiner who has years of volunteer experience with ABC. Remember, ABC provides all of the tools and supplies you'll need to perform all of the exam tasks. All you need is a pen to write with.
104!
There are 5 exam stations or modules. At each station, you'll be greeted by your examiner who will explain the scenario and make sure you understand the instructions before the module begins. Your examiners are ABC certified practitioners who had to meet a set of requirements to become an examiner. They have also gone through an examiner training process before they could even participate in the exam. They are trained to accurately record your answers and compare your responses to the standardized correct answers. Your examiner will take care of all of the exam paperwork, including asking you to initial your exam book to ensure that your candidate number is accurate on each of your exam books. The exam modules vary depending on which skills or competencies are being evaluated. Some of these modules will include interaction with patient models. You will need to treat these interactions as real-life patient situations, just as if you were seeing the patient in your office. Your examiner will read the instructions aloud, as well as give you a copy so you can read along. Once you've read the instructions, you will begin the task. Try to stay relaxed and only do what the question asks for. For those modules that involve patient models, you will be asked to demonstrate clinical assessment skills directly on the patient. In one module, you will be asked to take an impression of a transtibial residual limb. Again, ABC will provide everything you need to perform this task. You will be demonstrating your ability to follow the specific prescription and address the clinical situation described in the instructions. In each module, your examiner will be observing your technique and how you interact with the patient. One module will require you to evaluate a transfemoral patient and develop a prosthetic recommendation. There will also be an upper extremity prosthetic task that will test your ability to set up a harnessing or cabling system. This allows the examiner to evaluate your knowledge of upper extremity components and prosthetic function. Once you've completed all 5 modules, you will remain in the candidate lounge until you are dismissed from the exam. The Audit Team is a critical component of the Exam Administration Committee. Consisting of 2 experienced practitioners who have served many years as examiners, it is their responsibility to check every exam book for accuracy and completion. Until the Audit Team has completed their review of all of the exam books, you will not be released from the exam. We know that taking any exam can be very stressful, and an in-person clinical exam can be even more stressful. ABC takes every effort to make the CPM exam as stress-free as possible for each candidate. The ABC volunteers and staff who administer the CPM exam want you to succeed. Your education and clinical training have prepared you for this exam, so all you have to do is demonstrate what you already know. If you have any questions about any of the ABC exams, please don't hesitate to contact us. We are here to help you through the process. We wish you the best, whether you're preparing to take the exam in the near future or just reviewing the process to understand what to expect.